What is AIDS? How does HIV testing work? How do I protect myself? I'm Greg, and this is Sex Ed for Bad Bitches. So what is AIDS? It's important to note that HIV and AIDS are not the same thing. HIV, or human immunodeficiency virus, is a sexually transmitted infection that attacks and weakens your immune system. AIDS, or acquired immune deficiency syndrome, is a disease caused by HIV that makes it extremely hard for your body to fight off infections. Contrary to popular belief, people don't die from AIDS itself. Opportunistic infections, which are diseases that normally wouldn't affect someone with a healthy immune system, take hold in people with AIDS. Freddie Mercury, the lead singer of the band Queen, actually died from bronchial pneumonia relating to AIDS, not AIDS itself. How is HIV spread? HIV is carried in semen, blood, and vaginal fluids. You can get it by having vaginal or anal sex, or by sharing needles or syringes. HIV is not spread through saliva, and you can't get it by just kissing or touching somebody who is HIV positive. While HIV disproportionately affects gay and bisexual men, anyone can get HIV, regardless of age, sex, race, or sexual orientation. 1.2 million Americans have HIV, and almost 35,000 new cases are reported every year. How does testing work? When you contract HIV, your body produces antibodies to fight against the virus. An antibody test, which is the most common, looks for these antibodies in the blood. Generally, it can take 18 to 90 days for your body to make these antibodies. This means that for this period, your test results can come back negative, even if you have HIV. This is known as the window period. NATs, or nucleic acid tests, only have a 10 to 33-day window period and involve drawing blood from a vein to look for the virus itself. However, these tests are extremely expensive and only used in high-risk situations. Some tests, called rapid HIV tests, can give you results in 30 minutes or less. Almost all rapid HIV tests are antibody tests. These generally involve a cheek swab or drawing blood through a finger prick. You can even get an at-home rapid HIV test called OraQuick, which can be purchased at your local pharmacy or online. It's important to get tested regularly. If you're sexually active or share needles for drug use, piercings, or tattoos, get tested. It can take up to 10 years to develop AIDS, so most people who have HIV don't know it until they get tested. What if I have it? So, the results came back positive. The first thing to remember is that there is nothing to be ashamed of. If you or your partner have HIV, it doesn't necessarily mean anyone cheated. Like we've said before, most people who contract HIV don't know they have it until years later. How do I get rid of it? Unfortunately, HIV can't be cured. However, your doctor can prescribe antiretroviral medications that can lower the amount of virus in your body and slow down the damage it does to your immune system. Antiretroviral therapy, or ART, can lower your viral load to a point where it doesn't show up on standard tests. At this point, it's considered undetectable, meaning that you can't spread HIV to sexual partners. Undetectable doesn't mean cured. Even if your viral load becomes undetectable, it can still return to detectable levels if you stop treatment, meaning you can spread it to your partner or partners again. It's important to maintain treatment if you contract HIV. How do I prevent HIV? 1. Wear protection. The easiest way to prevent the spread of HIV is by wearing protection. Condoms and dental dams are 90 to 95% effective in protecting you from HIV. 2. Consider taking PrEP. PrEP, or pre-exposure prophylaxis, is a daily pill that can prevent HIV. It's especially useful for MSM, men who have sex with men, since they make up the biggest groups of HIV cases in the United States. If you think you've been exposed to HIV, you can take PEP, or post-exposure prophylaxis, within 72 hours to lower your chances of contracting it. 3. Use clean needles. Don't share needles when shooting drugs or getting tattoos or piercings. Seriously, AIDS is a big problem, especially among LGBT folk. So do you and your partner, or partners, a huge favor and put your minds at ease. December is AIDS Awareness Month, so get ready. PRISM will be sharing more info on AIDS and HIV throughout the month, from the history of the AIDS crisis to PrEP and everything in between. Go to www.prismfl.org/AIDS and follow us on Instagram and TikTok to learn more.
Click here to subscribe, or click here to watch another video. And if you really want, click here to apply, because as you can see, we're looking to fill a new boom person for our camera crew. But like, seriously, click one of them, subscribe.